If you're here, you're probably wondering one thing: how painful is hip replacement surgery? And I get it. Maybe you've been living with hip pain for months or even years. You can't walk through the grocery store without feeling that deep ache. You can't sleep through the night without rolling over in pain. Even tying your shoes or putting your socks on, or even getting into the car has started to feel like a chore. You're not afraid of the surgery itself, you're afraid of what comes after. How painful will it be? How long will it take to get back to your normal life? I'm Dr. Tyler Goldberg, an orthopedic surgeon and founder of TDG Concierge Services. Over the last 25 years, I've helped thousands of patients regain mobility through minimally invasive joint replacement surgery techniques. And one of the most common questions I hear is, Dr. G, what's the pain really like? The truth is, pain is a part of recovery, but it's not what most people imagine. Today, I'll walk you through exactly what happens and what to expect from the day of surgery through full recovery, so you can approach your procedure with confidence and clarity. The reality, what the procedure really feels like. Let's start with the surgery itself. Most hip replacements take about an hour. You're under anesthesia, which means you'll feel no pain and should feel no pain during the procedure. At our center, we use the AMAS technique of direct anterior approach, which allows me to replace the joint without cutting any major muscles or tendons. That's important because less muscle trauma means less pain afterward and faster return to normal walking activities. In fact, many of my patients take their first steps within an hour of surgery, safely with assistance, of course. And that early movement is the first step toward recovery. The first 24 to 48 hours, early movement and pain control. Now, I won't sugarcoat it. You'll feel sore when you wake up. It's a deep ache, achy soreness, not sharp pain. But here's the good news. Your preoperative hip pain is gone instantly. Now, let's talk about the pain that is there, and for that, I have a second piece of good news. Modern medicine has come a long way in how we manage that discomfort. We use what's called a multimodal pain management program. That's a combination of methods to control pain from multiple angles. We use preoperative medication to have on board during your surgery. We use local anesthetics during the surgery, in which we inject a pain cocktail around the joint, which will help you postoperatively. We'll also use nerve blocks if needed to numb the area. Anti-inflammatories and non-narcotic pain relievers are also used. Also, small doses of stronger medication when and if you need it. This allows you to stay alert, comfortable, and mobile from the very start. And yes, within the first 24 hours, we'll have you up sitting, standing, and even walking, with support, of course. That early movement not only helps prevent complications like blood clots, it jumpstarts healing, confidence, and circulation. Still wondering if hip replacement might be right for you? Drop a comment below. I'd love to hear your story or answer any questions you have personally. And if you're looking for clarity, take our free 2-minute joint pain quiz. It's a quick, helpful way to see if surgery might be the right next step for you. We're here to help you make confident, informed decisions about your care every step of the way. First month, managing expectations. Now, let's talk about the first few weeks after surgery. This is where patience pays off. You'll have days when you feel great and other days when you feel sore and swollen. That's normal. The first month is all about letting the soft tissues heal and not rushing the process. Here's what I tell my patients. Consistency beats intensity. Do your physical therapy exercises, but don't overdo them. More isn't always better in this game. Think of recovery as a marathon, not a sprint. If you listen to your body and follow your rehab plan, the results will come. By the end of the first month, most patients are walking more naturally, sleeping better, and beginning to feel real progress. Now, how much pain medication will you need here? Well, truth is, everybody is different and has a different pain tolerance. However, it's not uncommon for patients to use only Tylenol for pain relief. No narcotics. The 3 to 6 month window, turning the corner. At about 3 months, you'll be roughly 60 to 70% recovered. You'll notice a difference every day. Less stiffness, easier movement, and the ability to do things you haven't done in years, like tie your shoes. By 6 months, most patients are 80 to 90% recovered and back to their normal activities. They're golfing, biking, traveling, and simply living without constant pain. This is usually the moment when people say, I wish I'd done it sooner. That's when you realize you don't have to live with the pain and you can actually move forward again. And for those patients that have both hips affected, that's usually the point where you go, maybe I should have the other hip done sooner than later. The long game, full recovery, and what to expect. Full recovery can take up to a year. That's not because the implant isn't healed. That's because your muscles and soft tissues continue adapting to the new joint. And the best part, Once your recovery is complete, your hip doesn't feel better, it feels like yours again. I always tell my patients and remind them, we can replace your hip joint, but we can't make your muscles 25 again. So stay active, move often, keep your body strong. With proper care, most hip replacements last as long as you will last, and you can enjoy a pain-free, active, long life after surgery. The key takeaways: what you should know about hip replacement pain. If you take one thing away from this video, let it be this: modern hip replacement isn't about pain, it's about possibility. Here are 5 things to keep in mind. Number 1, it's not as painful as what you think. With advanced anesthesia and muscle-sparing techniques, discomfort is mild and manageable. Number 2, you will walk within hours of your surgery. Early movement is safe, and it's one of the best ways to heal faster. Number 3, expect soreness, not suffering. Your hip will feel stiff and tight, but sharp pain is uncommon. Number 4, rehab, but not too much rehab, is important. Healing takes time. Consistent physical therapy is what turns your new hip into a new normal life. And number 5, your future should be pain-free. Within months, most people regain freedom to move, travel, and live life without limits. Hip replacement isn't about getting old, it's about getting your life back. And when it's done with precision and care, it can completely transform your quality of life. If you found this video helpful, subscribe for more clarity, driven insights on hip and knee care. And if you're ready to learn what's next, take our free joint quiz linked below. It's a simple first step toward feeling like yourself again. I'm Dr. Tyler Goldberg. Thanks for watching, and I'll see you in the next video.